Eyelid surgery to tighten excess skin? I'm wondering what would be the best treatment, surgically or otherwise, for my upper eyelids. I'm scared surgery will leave me with a lot of lid just above my lash line and will make my eyes appear more bulging with little volume in the area below my brow. Would pixel laser treatments be able to tighten this excess skin? The side view is taken in the morning and looks a little puffier than it normally does.
Thank you for your question. You've submitted a question with photos and you've asked about a pixel laser and about your concern about having eyelid surgery to help tighten up the skin over your eyes. And one particular concern you have is about the eye not looking too bulgy. So, as a cosmetic oculofacial plastic surgeon, I deal with this kind of question every day. And it's important to really understand the limits of lasers and surgery and also have a clear understanding of outcome. And of course, that's why you submitted your question. But there's a three-dimensional aspect of this that we can't address without a physical exam. So when someone like yourself comes to my practice, this is what I typically do. I'll have them sit down and I'll apply a Q-tip and just kind of roll the skin underneath to show what would the strategic reduction of excessive skin do to change the appearance. I also noticed there's a little bit of a puffiness in the inner corner of the eye. So if you were considering just a laser procedure, you would not be able to address the puffiness because that puffiness in the inner aspect represents lower eyelid fat prolapse. So since you can't laser off fat from the outside, you would need surgery to reduce that fat. So it's very important to have a clear expectation of what you would look like after a procedure. Now, people have tried to address upper eyelid excess skin with laser. What are we doing when we're applying laser? We're applying thermal energy, heat, to try to get the skin to contract in a way and smoothen to the point where a lot of that extra skin gets tighter. The thing is, when you try to apply heat aggressively, it becomes difficult to predict how much skin you'll tighten and to what degree. So you can certainly try a laser like a CO2 laser, and people have done that, and invariably there's improvement. The question you have to ask yourself is how much improvement would be acceptable to you. So I think a consultation with a qualified surgeon would be very important, and looking at yourself with the rolling of the skin so that you could see how much eyelid would show. The reality is that you have a certain range of skin that can be addressed, because you have to understand if your eyes are prominent, when you close your eyes, you have to have enough skin to be able to close your eyes. So if you are trying to just basically cover a round shape, you can't just aggressively take so much skin that you'd have difficulty with eye closure. So there's a range. You can be conservative or slightly more than conservative, but you can't be too aggressive. So a lot of times with patients like yourself, I would do a combination. If it's the textural issue of the skin quality is part of this, I would do a conservative removal of skin, and I would do fractional CO2 laser. This way we address both, and I would take out that little bit of fat pocket, and you get a nice smooth contour. I think sometimes we have to look at ourselves from the big picture rather than just focus in on the little details and get a sense of what does your face look like in terms of the appearance that you want to project, and use that as a measure instead of isolating just on the eyes alone, because it's in context. When people see you, they're looking at the whole picture. And if your eyes look brighter and more open, then that certainly won't be too bulgy. So again, meet with a qualified specialist and learn about your options and get a sense of what you can expect from a procedure like upper eyelid surgery, conservative and combination with CO2 laser. but I probably would advise against doing just the laser alone. Again, this is all based on just the photos and not a physical exam. So I hope that was helpful, and thank you for your question.